I just started my own business. Where can I go to find qualified applicants for my staff?
I have questions about new procedures in the industry. Who can I ask?
Where can I sell my old equipment so I can buy new equipment?
I just graduated from school. Where or how can I find a job?
You may have questions about the beauty industry, but don't know where to find the answers. That's where Salon Channel can help. Whether you're choosing career opportunities, searching for a school to learn and be certified, looking for professional equipment and products to build your practice, networking on our message board to build relationships with other professionals, finding someone qualified to join your staff, selling items on our auction, or just simply discovering yourself. You will find your answers on Salon Channel's easy-to-use site. Every business needs information and contacts to stay competitive and profitable. That's what Salon Channel offers. You are an expert, a friend, and an inspiration. Know your industry. Know your clients. Know who you are. Salon Channel, where beauty meets technology. This video is brought to you by Aesthetic Video Source, the leader in quality educational programs for professionals in the spa and beauty industry. Among our award-winning videos, you will find instruction in every aspect of the business.
Push, rip, and apply pressure.
You will learn from seasoned professionals who currently work in the industry.
So now I'll do the second cleanse with the steam going on my client.
Not only are they experts in their particular area, but they also know how to effectively teach others. As a professional, your education is ongoing. Our video training is a great way to learn new treatments and services, or to enhance your knowledge of services you already provide. These programs will improve and expand your knowledge of services, help streamline your business, and ensure the most pleasant experience for your clients. For a complete list of our training videos, visit our website where you can order online, request a catalog, and share ideas with other professionals on our message boards. Thank you for choosing Aesthetic Video Source as your training provider. Enjoy the program.
Hi, I'm Susan Brown. Aesthetic Video Source and I welcome you to this instructional video on cellulite massage techniques. I've been a licensed massage therapist since 1996, and I've been practicing cellulite massage since 2001. Since cellulite plagues most women regardless of age or weight, this is a great massage to offer. Cellulite massage helps reduce the dimpling appearance caused by cellulite. It helps cleanse toxins stored in fat cells and promotes dimensional loss. On average, my clients have lost 6 to 12 inches from the lower abdomen to the thighs. This is a massage therapy technique with long-lasting results. Let's quickly describe how cellulite forms in the body. Our body is made up of a series of layers. The first layer we'll talk about is a layer of muscle. Surrounding this muscle is fascia. On top of the fascia, we encounter a layer of adipose tissue or fat cells. On top of that, we have more fascia, and then we have the layers of skin. Connecting the two layers of fascia running through the fat cells are thread-like connective tissues called septa. In women, these fibers are far apart. As women get older, the connective tissue becomes more rigid, and our fat cells start storing excess toxins that the body hasn't flushed out through sweating and various bodily systems, such as the digestive system. These fibers stay rigid, but the fat cells don't. They push up against the skin like an overstuffed couch, and that's what causes the cottage cheese dimpling effect we call cellulite. In women, we see this most commonly around the lower abdomen, thighs, and buttocks. Cellulite massage works by loosening up the fascia, softening it so it's not so rigid, and softening the fat tissues and expressing the toxins and directing them into the lymphatic system. However, it's not a one-time deal. It involves a 6-week program with 3 massages per week, totaling 18 massages. It's intensive work, but it's worth the effort. This massage protocol is very straightforward. If you're a massage therapist with knowledge of the lymphatic system and myofascial release, you'll be able to perform this massage without any problems. Our objectives in this instructional video are to help you learn about benefits and contraindications of cellulite massage, setting realistic client goals and expectations, measuring and tracking clients' progress, the program regimen for completing this therapy, the steps and strokes involved in the procedure, and the follow-up recommendations for your clients. While relatively new to the U.S., cellulite massage has been offered in Europe for many years. It is highly effective and considered an alternative to liposuction. There is no downtime and obviously is non-invasive. Clearly, the selling benefit of cellulite massage is the dimensional loss. Without changing their lifestyle, clients can expect to lose 6 to 12 inches total from the abdomen to the lower thighs, even if they've dieted and exercised to a point where they've reached a plateau. Inch loss is definitely an attractive benefit. By following the cellulite massage protocol, the treatment series even retrains the body on what to do with toxins. Toxins come from everywhere, with whatever our bodies come into contact. Food we eat, air we breathe, water we drink, lotions we put on our bodies, antiperspirants, whatever toxins we ingest or encounter in our environment. With the high amount of toxins in our environment, the liver, kidneys, sweat glands, and lymph system can't always keep pace, so the excess gets deposited and trapped, particularly in the fat cells. This massage works by softening the fat tissue and expressing the stored toxins into the lymphatic system. The body then flushes the toxins out through the urinary tract or lower intestine. So the massage breaks up the toxins in the cellulite that have been weighing down the client, literally and figuratively. Cellulite massage retrains the body to flush out those toxins instead of store them. While it doesn't get rid of fat, the massage softens the fat, so the client also has the added benefit of smoother skin and less dimpling. Another side benefit is that clients experience more energy and just feel better. There are a few contraindications that you should be aware of. Varicose veins, skin lesions, cancer, pregnancy. Before committing to a 6-week program, I do an initial assessment on each client to determine if they are a good candidate for the procedure. Not everyone will get the desired benefits from this program. The ideal person is a person that is within 20 to 30 pounds of their ideal weight. They have an active lifestyle and they eat well. They just have problem areas that they're not able to get rid of. People who are more overweight can also benefit by doing this program and then repeating it 12 to 18 months later to reinforce what their body has learned. They will definitely benefit from the inch loss. As part of the initial assessment, I check the tone of the fat. Softer fat responds faster, harder fat takes longer. If the client has extremely hard, dense fat, then it's recommended that they complete an 18-session course and immediately follow it with another 18-session course. For example, women on birth control or under a lot of stress tend to have dense fat. I push up on the thigh to get a feel for this. If I feel a potential client is right for the program, I will stress to them the importance of the commitment level involved. The full program is 3 massages a week for 6 weeks. This is intensive work, and they're going to feel a bit tenderized sometimes too. So I describe the full program and have the client's contract up front with an agreement form. In the form, they agree to stay with their regular eating habits, presuming they are on a healthy diet. If they have any dramatic weight change or emotional issues, they agree to let me know about it. They agree to keep all of their appointments. They agree to let me publish their photos, without their faces of course, and their inch loss numbers. They also fill out a medical history intake form which includes a diagram on it for clients to circle areas of concern. And of course, I have them pay up front. That's a great incentive for them to complete the program. I do charge by the body area. Most women want work on the stomach, glutes, and thighs, which is where most of us have problems with cellulite. If they want arms, back, or face, I charge accordingly. I won't be addressing those techniques in this video since these procedures are more about dimensional toning and we're focusing on cellulite massage in this video. The going rate for 18 sessions on the lower body is $1,899. I strongly encourage you to keep it at that level. It's a long-term therapy that requires client commitment and is obviously a taxing workout for you as a therapist, not to mention the time-intensive record keeping involved. Throughout the program, I record the client's measurements to track their progress. First, I weigh the client. Then, I have the client strip down to their underwear to take measurements. I generally recommend that they wear thongs since I'll be working on their glutes. For measurements, I measure at the navel, 3 inches below the navel, the top of the pubic bone around the glutes, and the top of the leg at the fullest part of the thigh, and 4 inches above the patella. I measure both legs. I'm here with my client Marie, and we will be doing her initial assessment and her initial measurements. The supplies you'll need for this section will be a new tape measure, and I use a new one with each client for hygienic reasons, and the client tracking sheet. Okay, Marie, can you please raise your arms? Okay, turn this way. Okay, to assess her cellulite, I'm going to place my hand firmly at the bottom of her thigh and just gently press up. What I'm looking for is to see the dimpling effect that is caused by this action. And you can see on Marie that she has light cellulite starting to form. The other thing I'm checking for is for the density of her adipose tissue. Marie has moderate to dense tissue, so this procedure will work on her. She just won't see results as quickly. For measuring, if you'll just turn this way, our first measurement will be at the navel. The second measurement will be measured in 3 inches below the navel. The third measurement will be at the top of the pubic bone. And then each leg will be measured at the fullest part of the thigh and then 4 inches above the superior aspect of the patella. So for her first measurement, we'll pull the tape around. Make sure that the tape is even and positioned evenly on both sides of her body. You pull the tape so it is snug but not tight, and you don't have your fingers underneath it. Her measurement now is at 32.5 inches. For the second measurement, just measure from the bottom of the navel to 3 inches. Again, bring the tape around, making sure it's positioned evenly on both sides. Pulling it snugly but not tightly, and she's at 34.75. The third measurement, you just feel for the top of the pubic bone. Bring the tape around, making sure it's even on each side. Pull it snugly but not tightly, and it's at 37.75 inches. To measure the thigh, I visually determine the fullest part of the upper thigh, and on Marie, that's about right here. Again, we place the tape, we pull it snugly but not tightly, making sure it is even all the way around, and she's at 23.5 inches. For the lower aspect of the thigh, I'll feel for the superior aspect of the patella, place the tape there, measure up 4 inches, measure around, and she's at 18.75 inches. And I'll repeat the process on the left thigh. So turn a little bit this way. Again, I visually determine the fullest part of the thigh. And find that she is at 23 inches. I'll feel for the superior aspect of the patella, measure up 4 inches, measure around, and she's at 19.25 inches. That concludes our initial assessment and the initial measurements. These measurements, written down each session, ultimately attest to the success of the program. When they see the inches add up, they know it's been worth it. Ultimately, this is the best way for clients to see the end results. It's also an excellent way for me to show prospective clients what can be achieved. We now have Marie on the table in a prone position, and we're ready to start our procedure. The first area we will work will be the lower back. From the lower back, I will move to the thigh area that is closest to me. Then I will work the glute on the opposing side. I will then change sides of the table and work this thigh and then this glute. To begin with, I will take the palm of my hand and I'll place it on the lateral edge of the spine. The other hand, I will reach around her body onto the ASIS, and I will roll her up and then push her forward. I roll her up quite a bit, and I push down very firmly, being careful to stay off the spine. I do this a series of 3 times. When that's completed, I move to the other side of the body and work the other side. Again, placing the palm of my hand along the edge of the spine, rocking her up and pushing her down. This helps to loosen the fascia of the lower back and to increase circulation to the lower limb. We're now ready to work the thigh. The first thing we're going to do is friction to help warm up the area, to soften the tissue, and to make it more comfortable for the client as we go into the fascial release. We want to start skin rolling. and we start by the knee. This area here tends to be one of the most tender areas. It's also an area where there are the most fascial adhesions. That's why it's tender. So when we start, we're going to start very lightly. We're going to do each movement a series of 3 times. The first pass on the thigh is done very lightly because we are just working the fascia directly below the skin. We work from the inner knee to the gluteal fold. The second pass will work more deeply, and we start engaging the adipose tissue. We want to soften that tissue so that we can start expressing and expelling the toxins that are stored in the fat. The third pass is deeper still and engages the fascia and around the muscles. You can see as we're working that the surface of Marie's skin is beginning to get red. After having done those 3 passes, we're going to do more fascial release. I'll take my hand, I'll anchor the area, I'll take the palm of my other hand, and together, I'll press down, and then together we'll slide up along the fascia. This is working the fascia that's very deep around the muscle. And again, we will do this a series of 3 times. Once we go up the center, then we'll go to the side. Again, anchor and just glide together. When doing this, you want to be careful to stay off of the bone because that's very uncomfortable. Now we're going to go to the inner thigh. And we want to direct the motion this way as we're going up in this area. Now we'll go through and do compression to help express the toxins from the softened fat tissues. And we always work from the bottom or from the knee toward the glute. The next step is topotement. It's a loose fist topotement, and the movement is just in the wrist. You want to keep your shoulders and your upper arms and your neck loose. You want to be sure and cover the area very thoroughly. This helps to increase the circulation to the area and tighten and tone the skin. At the completion of the topotement, you go into the lymphatic drainage, and this is one of the most critical portions of this protocol. The lymphatic drainage takes those toxins that we've just loosened from the adipose tissue and it flushes it out of the body. To do the lymphatic, we're going to start at the gluteal fold, and the direction of our hands will be in this direction here. Lymphatic is very, very light work. You don't use a lot of pressure. This is also a portion that probably takes the most time as far as one procedure. We're just going to gently direct the lymphatic flow around to the front of the body. So we flush the entire lymphatic system as we're working down the thigh. And once we get down to the very bottom of the thigh, we're going to start working up towards the gluteal fold again. We'll continue to direct the lymphatic flow around to the front of the thigh and into the inguinal area of the lymph nodes. That completed, we'll go to the gluteal area on the opposite side of the table. Again, we're going to start by frictioning the area to bring circulation to the surface and to soften the tissue. Once that's done, we'll start with the skin rolling again. We'll start working very lightly. When we get to the end or to the gluteal crease here, then we'll start, just do a gentle tug up. And we'll work the entire gluteal area. The second pass, a little deeper, we're now engaging the adipose tissue. And then the third pass is deeper still, engaging the muscles. Following the skin rolling, we will do compression. And again, we want to compress towards the inguinal area of the lymph system. Again, you'll see that she's got good red color going, and now we go into the tapotement, and this is to tighten and tone the skin and to increase the circulation. Okay, and that completes this gluteal area. And now we move to the other side. We'll start by applying friction to the area. Again, this is to warm the tissue, to soften the skin, the fat, and the fascial material. And we will start again with the skin rolling. The skin rolling is part of the myofascial release. The first pass is light. We're simply engaging the skin and the first layer of fascia. The second pass is deeper. We're going beyond the skin and the first layer of fascia and into the adipose tissue. And the third pass is the deepest, going into the final layer of fascia as well as the muscle. As a therapist, you want to watch your posture. You want to rock with the movement and use your whole body, bring your strength through your trunk of your body. Once we're done with the skin rolling, we'll do further deep myofascial release. Again, we're going to anchor the area, take the palm of our hand, apply pressure, and it's a fair amount of pressure, and glide up together. This is fairly deep and can be uncomfortable for the client, so be really careful not to pull the skin. You want to move both hands together. The upper hand performs sort of a rocking motion as it moves up. Following that, we'll do compression. Again, we start at the knee and work our way up to the gluteal fold. Following compression, we'll do tapotement. Following the tapotement, we go back to the lymphatic drainage. Again, we're going to start by the gluteal fold, and the direction will be up and around to the front of the body to the inguinal area of the lymph system. This is very light movement, and you're acting as a pump. So I will apply very light pressure as I go up and around and release that pressure and come back and start over again. This portion should take about 2 to 3 minutes. Some clients will experience minor bruising, especially in the beginning of the protocol, and that's normal. And you need to explain that to them in the beginning. One of the questions on the medical intake form is do you bruise easily? And that will be a good time to discuss this with your client. If it is excessive bruising, then you need to work a little bit lighter on them until they become accustomed to the work and what it is that's being done. We've worked our way down the thigh from the gluteal fold to the knee, and now we're working back up towards the gluteal fold. That being done, now we'll move to the opposing glute. You'll notice that draping is not used during this procedure. Due to the aggressiveness of the movements, draping is really difficult to do. So instead, we simply have the client wear a thong. It's important that when they are having their pictures taken, that you try to have them taken in the same thong each time because of the way the thong will fit. So again, now that we've moved to this gluteal area, we're going to start with friction. We want to get the area nice and warm. We want to soften this tissue so it'll be more comfortable to work. Okay, we'll begin the skin rolling, starting at the gluteal fold and working our way up. The first pass is superficial. We are engaging the skin and the first layer of fascia. Our goal here is to help break up the adhesions in the fascia. So we will work each layer separately to do that. Okay, the second pass, we're working a bit deeper and we're working into the adipose tissue. We want to soften up that tissue and soften up all those little fat cells so we can start expressing the toxins. The third pass is deeper still, and that's where we engage the last layer of fascia and the muscles. Now we're going to do our compression. And again, we want to compress and direct the flow towards the inguinal area of the lymph drainage system. Okay, following the compression, we'll do tapotement. I use a gentle open fist and very loose wrists. We really don't want to pound on them. We just want to stimulate circulation to the surface of the skin and to tighten and tone the skin. Okay, so now we're going to do the lymphatic drainage. We'll start here on the lateral side of the glute. And again, it's very gentle, soft, light movement. It's a pumping movement. And we're directing the lymphatic flow to the inguinal area of the lymphatic system. This is the part that clients tell me feels really, really good. And they're really happy for it after all the myofascial release. Take your time when doing the lymphatic drainage. This is not a process to be rushed. Now we've completed the hands-on work. Now it's time to apply the cellulite lotion or gel. There are many products that are over the counter. Choose the one that you like. You'll want to apply this liberally. And this is applied with quick, light strokes. This is not massage. This is just simply applying a product. That completes this side of the body. We now have Marie in the supine position on the table. I'll move to the head of the table where we will work on her lymphatic system and open it by pumping the terminus. We'll pump very, very gently, and we'll pump 7, 8, maybe 9 times. The goal is we want to see the client swallow. That means that the lymphatic flow has started. The terminus is located just right above the collarbone. And there she swallowed. That's what we wanted to see. If they don't swallow, you gently start working the lymph nodes. You start by the collarbone and gently start pumping and working up the sides of the neck towards the back of the mandible to the area behind the ear. And then you work your way back down towards the collarbone. Again, it's that gentle pumping motion. When you reach the terminus area, you just gently pump the terminus again. Following the terminus area, we move to the abdomen and we work on opening the vena cava. That is the major dumping area for the lymphatic system. You'll place your fingers just below the xiphoid process. Have the client take a deep breath in as you apply pressure to the area beneath the xiphoid, and then as they breathe out, you take the heel of your hand and press right below the navel. Okay, breathe in again. And out. You do not want to do this if they have eaten recently. There needs to be a 2-hour wait time before doing this particular procedure. And breathe out. You will do this 3 times. Okay, now the lymph system is open and flowing, and we'll start the skin rolling as we did on the other areas of the body. We'll start at the bottom of the abdominal area and do light superficial skin rolling, and we will work towards the midline here on the body. We will work as far as the upper aspect of the navel. The second pass is deeper. The final pass is the deepest pass, and you're engaging the muscles of the abdominal wall. After completion of doing that side of the body, change to the other side of the table and work the side of the abdomen that's on the far side from you. The first pass again is light. At the end of each pass, just do a gentle tug up. We're working against gravity. Second pass is deeper. As a therapist, what you are feeling for is the separation of the fascial tissue. And you will begin to feel that usually after the 2nd or 3rd week. So after completing this last series of rolls, then we're going to go and we're going to do deeper myofascial release. Again, I will anchor the area with my one hand, and then I'll take the opposing hand and we're going to just glide upwards. This is working the rectus abdominis muscle and doing myofascial release on it. Again, we're going to do it in a series of 3. And this is very deep work. Your client may want to go to the bathroom before you do this. Then we'll go over to the other side and work the other side. You just work up to the bottom of the navel, and you start right at the top of the pubic bone where the attachment for the rectus abdominis muscle is. And you want to stay just in this area right here on either side of the belly button because that's where the erectus abdominis muscle is. The next section is going to be the belly lift. And the belly lift is like doing 100 crunches all at one time. And it's the one that a lot of clients say is the most uncomfortable. I gather up the abdominal fat and skin. On some clients, you'll want to grab it this way. If it is a male client or a person with a really large abdomen, you can grab this way. So you just do whatever works best for the client on the table. So I'm going to grab her belly fat and I'm going to have her take a deep breath in. As she breathes in, I will lift her belly up towards me. I'll then have her expel her breath, and as she's breathing out, I will continue to lift towards me and I will pull towards her head. She will be tilting her pelvic region and putting the small of her back against the table. So she is moving in a direction opposite from my direction. Are you ready? Okay. Take a deep breath in. Okay, now breathe out and resist, 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 and feel that pull. Very good. We do just a few nice little movements here to relax the tissue. We're going to do this again. We'll do it a total of 3 times. Ready? Breathe in and breathe out and resist, 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 resist. Good. As you continue through this protocol, when you do this exercise, you're going to start feeling the layers of fascia separate, and it's going to be easier to pull up on the tissue and to pull it towards her head. The other thing that you notice is that the shape of their abdomen will start changing. You'll notice that they'll start getting flatter through this lower abdominal area. This area right below the belly button might be getting a little bit poochier, and that's just part of the normal flow of what's going on. This will go away. Okay, ready? Breathe in and breathe out and resist, 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 just as tightly as you can. Good job. It's always exciting when you start feeling that fascia release and it gets easier to do this. It's exciting for the client because it doesn't hurt as much. So that part's really good. Now we're going to move to the leg. We'll begin by going into the inguinal lymph area, and we're just going to open up this area by gently pumping the area. You want to use the hand that has the little finger towards the pubic area so it doesn't feel invasive to the client. And again, you're just doing a gentle rocking, pumping motion. This is something that feels good to the client, and it's a very soothing thing to do. This should take about 3 minutes. Once this is done, then we just follow the protocol that we've done in the other areas of the body. Put your hand up here. We'll go through and do friction to warm up the area. Again, this softens the tissue and it brings good circulation and blood flow to the surface. And then we're going to start skin rolling. Again, this area they're very, very tender in, and this area they're very tender in as well. And this is an area that women especially want to have worked on. They don't like having that skin rubbed together. When working this area of the upper thigh and in the area of the abdomen, oftentimes emotional issues can come up. If it is something that's just major and just a little teary, I just hand them a tissue and I just keep working. If it's something that's a little more intense for them, then I may suggest that they seek professional help. We're going to start right above the knee, and we're going to work very light. It's very superficial. We're simply working the skin and that first layer of fascia. Again, this breaks up that fascia, and it helps to increase the circulation to the area. The second pass is a little bit deeper. We're now working into the adipose tissue area. Remember, this is the area where the septa is, and we want those connective tissues to be softened. And the third pass is deeper still, going into the muscle layer and the fascia around the muscle. When I first begin on a client, I do not work as deeply as I do when I'm finished with them. I gradually work into it. Having finished the skin rolling, we're going to do the myofascial release, where we are anchoring with our one hand and then pulling up with the other hand. I'd like to caution you to stay off of the bone. It's very uncomfortable. You want to work slightly off the femur and work on the rectus femoris. And you don't want to drag and pull the skin in opposing directions. You want it to go with you. And again, we do each one in a series of 3. After completing the rectus femoris, I'm going to slightly rotate her leg, and this is more for therapist comfort and ease. And we're going to work the vastus lateralis. You want to stay off of the IT band and just work this side of the vastus lateralis muscle. So again, I'll anchor and then plant my upper hand and then move the 2 hands up together. Again, it's done in a series of 3. At the completion of that, we'll rotate the leg back to its original position, and now we're going to work the adductors. When you're working the adductors and you're moving up the leg, you want your motion to be like this, going towards the inguinal area. You do not want to apply pressure to the inguinal triangle area, which is right here. Okay, following that, then you want to do your compressions, again going from the knee to the top of the thigh. And then do tapotement. You'll want to use your legs to get down to the sides of your client's legs as opposed to bending from the waist. That will save your back. Always remember your body posture and use good body mechanics. And now we'll finish with lymphatic drainage. Again, starting in the inguinal area, we're just going to gently pump. And we will move from the inguinal area to the knee and then back up to the inguinal area again. This protocol is extremely effective, and it has been used to replace liposuction for quite a while. I have had clients that have come in following liposuction that have been upset with how lumpy they look and how disfigured their body is, and we work on evening that out. It will not permanently correct the problems, but it will help to even out the lumpiness that they experience. This procedure can also help diminish that saggy knee look that women get as they get older, where their skin starts sagging above their knee. It can help tighten and tone and lift the skin to a degree. Okay, as we complete the lymphatic drainage on this side, then we will move to the other leg. Now we're ready to start on the other leg. We'll start by pumping the inguinal nodes. Again, this should last about 3 minutes. Once we've completed this, we'll do the friction. It's very light, gentle movement. Okay, and now we will start the skin rolling. Through the course of today's video, we've done a lot of talk about women and the cellulite massage, and we have omitted men. Men do not have the same concerns that women have when it comes to cellulite. Men generally don't have it. So when men come in for this procedure, it looks different because we're having to work the area differently due to the fact that they are looking for dimensional loss as opposed to cellulite smoothing. We're addressing the lymphatic system differently because we are crossing the watershed areas. Final pass is the deepest. Be sure to check in with your client to make sure that they're not too uncomfortable. Okay, following the skin rolling, again we're going to work on the rectus femoris. So I'll anchor with this hand and then glide up with the second. We want to stay off the femur and stay on the muscle. Then rotate the leg slightly and work on the vastus lateralis. remembering to stay off the IT band. And as you move up the leg into the upper thigh area, remember to stay out of the inguinal triangle. Do compression up the leg, always directing it towards the inguinal nodes, and then to potement. Remember to keep a loose fist and relaxed wrists, and to use your legs to work the various aspects of the thigh. And now we'll finish with the lymphatic drainage, starting with the inguinal nodes. When you first start this protocol on your clients, it can be very uncomfortable for them. By the time you've completed the 18 sessions and you're at the end of the 6 weeks, they will miss you. They really get to where they look forward to this and they enjoy it. After completing the lymphatic portion on this leg, you'll just go up to the terminus area again and give it one light pulse. And that concludes the hands-on portion. And now you take your lotion again. And lightly apply it to the areas you've just worked. Remember, you're not massaging, you're just applying a lotion or gel. When my clients sign up for this work, I will send a bottle of the lotion or gel home with them so they can apply this on a daily basis. And it just helps support the work that you're doing. And that's included in the price of the protocol. And that completes our cellulite massage. After each session, the body begins to flush toxins from the system through the usual cleansing processes. Clients should experience increased bowel movements through the treatment period. If they don't, I recommend they increase the roughage in their diets to help flush the toxins from their body. To prolong the benefits of the massage and to maintain good health, I also suggest the following to clients. Improved diet. I encourage clients to eat healthily. They don't need to go on a diet unless they're eating fast food 3 times a day. They just need to eat smartly. Lots of fruits and vegetables, lean proteins, plenty of water, and limited alcohol. Basic common sense stuff. They can reduce the body's toxic burden by avoiding processed foods, eating organic when possible, and minimizing simple sugars and carbohydrates. Take a daily multivitamin. Multivitamins support cellular function, digestion, and elimination. For example, vitamin C restores skin structure and the formation of collagen and elastin, which is critical for healthy skin. Drink plenty of water to keep the body hydrated and fluids flowing. I really encourage drinking a lot of water. I tell clients to take their body weight and divide it in half, and that's how many ounces of water they drink each day. For example, a 200-pound person should drink 100 ounces a day. Exercise regularly. Since the lymphatic system doesn't have a pump, it relies on movement to move the lymph. Exercise, deep breathing, and massage are 3 fundamental ways to stimulate the cleansing flow. Exercise also brings nutrient-rich blood to the skin, burns excess fat, and increases muscle tone. Practice deep breathing from the diaphragm and through the nose to promote lymphatic flow. Sweat regularly through exercise or saunas to help detoxify the body. Avoid aluminum-based antiperspirants that block sweating and add to toxic load. Have follow-up massage every 2 to 4 weeks to flush out any toxin buildup. Cellulite Massage has definite visual results, as you can see with these before and after shots. Photographs ultimately provide the best way to validate those results for clients. Some clients provide different challenges. Let's take this client for instance. We'll look here that she started at 117 pounds and she ended at 118 pounds, so weight really wasn't her issue. Her concern was with her lower body and the shape of it. In this, her before picture, you can see that she has a limited curvature here on either side of her waist, and you can see darker shadowing down here indicating that she's got this pooch in her lower abdomen. You can also see that she's got some fullness going through the thighs here and here. These were her areas of concern. In her after photograph, you can tell that there is more curvature here at the waist. She definitely lost inches there. And there's less shadowing here for the lower abdomen. You can see a slimmer look on the side of the hips here and here. In this side view, again, you can see the protruding belly here, and you can see that there's this roundness over the top of her underwear. In her after photograph, you see a much slimmer side view of her abdomen, and you can see a slimmer side view of her lower back as well. In looking at her chart, you can see that she started at 117 pounds and she ended at 118 pounds, so she was able to maintain her weight in a very even sort of way. In going to her inch loss, her measurement at her navel in the beginning was 30½ inches. She ended at 28 inches, so she lost a total of 2½ inches. The measurement 3 inches below the navel started at 33¼ inches and ended at 32½ inches, a difference of 3/4 inches. The measurement at the pubic bone area was 35½ inches and it ended at 34½ inches with a total inch loss of 1 inch. Her upper thigh on her right leg started at 21 inches and ended at 20 inches with a total loss of 1 inch. The area above her knee started at 17½ inches and ended at 16 inches, losing 1.5 inches. On her left leg, the upper thigh measurement was 20.5 inches, ending at 19 3/4 inches with a difference of 3/4 inches. And the knee area starting at 16 3/4 inches and ending at 16 inches. Again, a 3/4 inch difference. You can see that even though her weight increased by 1 pound, she still lost a total of 8 1/4 inches. She came in telling me that she is having to have all of her pants altered so they would fit her again. So she was thrilled with the results, and so was I. Most women have cellulite. It's just a fact of nature. Cellulite massage is an attractive alternative to invasive surgery. Not only is it good for the client, but it is very lucrative for the therapist, considering each session runs 30 to 45 minutes in length. I'm Susan Brown for Aesthetic Video Source. Thank you for joining us.
For more information about this program, or to find out about other programs offered by Aesthetic Video Source, please contact us. Our address is Post Office Box 188, West Jordan, Utah, 84084. To call us from outside North America, dial 801-282-2490, or toll free from North America at 800-414-2434. Visit our website at videoshelf.com to find more information or to